I hope everybody is well, healthy, and appropriately socially distancing. I know this is a very challenging time for everybody in this society, medically, economically. There's so many ways that our lives are being tested at this moment. And I want to underscore it's a moment like this that groups, people, institutions have to come together. We have to support each other. We have to care about each other and work for each other. And that's what I think is so great about Tulane University. We're a community. We've come through Katrina. We've come through all sorts of challenges. And this is clearly COVID-19 and all of the challenges in our society right now are issues that we need to confront and deal with. And as part of that, we're putting this webinar is to talk about the plans for the fall semester. There'll be four different webinars. This is sort of an overview, especially so you can hear from the medical people at Tulane University. But there'll be three that follow. Tomorrow, there'll be one led by Provost Foreman on faculty and one on staff coming back with Patrick Norton, our COO. And then the following day, the Dean of Students, Dr. Dusty Porter, and Provost Foreman will have a webinar for incoming and returning students. Each of those webinars will go into detail about the plans, and we will also respond to questions, not only as part of those webinars, but questions submitted online for all. This webinar is really to talk with an overview. And what I want to underscore is how much we have been focused on the health and safety of the Tulane community in every way. And as I step back, I know of no university in the country that has a broader array of initiatives that we have put forward to protect the health and safety of the community. The way I like to think of it is sort of a belt and suspenders. There are multiple different layers. We've consulted with faculty in the medical school at Tulane, School of Public Health. We looked at CDC guidelines. We have also consulted with the city and state in Louisiana and New Orleans about what we ought to be doing in these circumstances. And as you know, we started with 7 different committees on campus doing deep dives in every area. And they came up with plans that we released to the entire community, really for notice and comment, feedback from you about what we ought to be doing. And then we have, in a sense, come out with a further plan in light of all those comments and further developments about what we envision for the fall semester. There's an extensive website with all sorts of details, with Q&As as well. But we thought of this as an opportunity to really give a broad overview. Let me emphasize that nowhere in the society at this moment in time can you eliminate all risk. Wherever you are, whether it's in New Orleans or in New York City or California, the Midwest or abroad, there is always risk. Our goal has been truly to minimize the risk on this campus. We view ourselves in some sense as a city so that we can take multiple precautions across the board to protect the community. Now, let me say we understand that there will be students who want to, in a sense, learn remotely than in these circumstances. It may be because you have pre-existing conditions, maybe for other reasons. And we have worked through all of those requests, and we understand that. We also know there are faculty and staff, those who are at special risk or for other reasons need to work or teach remotely. And again, we've worked through that as well. But what the purpose really today is to give everyone a sense of all that we are doing to protect the health and safety of the community and answer questions. So to start out, let me note, is testing. We are testing every single member of the community. That's students, faculty, and staff, everybody who comes onto the community before they come back, we're going through a rigorous testing program. We're also envisioning continuing surveillance of individuals while they're here at Tulane University throughout the fall semester. In terms of students coming and living on campus, we've established a welcome center in a hotel, the Hyatt, a very large hotel in downtown New Orleans, so that new students coming to campus would go there, and it's a very large hotel to allow for socially distancing, and would be immediately tested and stay there until the results come back negative, and then they can come to campus and we'll have transportation to campus. While you're there, it's a great opportunity for orientation, to go over our plans for the fall, your obligations to be part of the campus. We will, of course, be doing testing for students who are not living on campus at the Uptown and Downtown campuses testing center, all employees before they come back to campus. And again, continuing surveillance throughout the year, throughout the fall semester, to detect anything that might be arising. Let me also note that should somebody test positive, we've set aside a dorm, which is the old infirmary from my days, so that students can stay there and isolate until they test negative. And that's available for students living on campus as well as students living off campus. The campus itself, we really are limiting so that there are no visitors. We want to maintain sort of an environment that is protected from lots of disruption from the outside. We're limiting access. We want everybody to socially distance, which means everybody is supposed to wear masks whenever they're in a public space on campus. And we want everybody to take temperatures and look for symptoms so that we can test in any situation. We've gone through the entire campus and looked at offices, put in plexiglass, put in distancing between offices. So again, employees coming back to work will be distanced. For those that obviously employees who are at special risk for other reasons, we're creating extra precautions, including working from home. We've also looked very carefully at our classrooms. We want to make sure and create all of the proper distance. And therefore, we've added 18 new classrooms, 18 temporary classrooms on the campus. The campus is transformed. For those of you who have an image of what the Tulane campus looks like, it's very different now. In all of these classrooms, in a sense, the classes rooms will be much larger than traditionally would be needed for the class. So they allow for distancing of class and also separation in distance between the teacher as well as the students in that class. We've undertaken similar precautions with food. As you know, 2 years ago, we had Bruff, which had seating for 450 individuals. Last year, we moved to the Commons that had over 1,100 spaces. So we expanded considerably. We built another facility, temporary facility right next to the Commons to allow another 350 people to eat. Again, it's a very, it allows for distancing and no congregation. We've looked at in and out, we've scheduled classes so that in a sense there won't be congregation on the in and out. Some of our classes will be online, fully online, about less than a quarter. Most of the classes will be on ground, but they will be classes where there is the capacity for hybrid, so that if, for example, a student came down with COVID-19, they could be isolated and they could continue to take that class online, as it were, in the interim. We have radically cleaned all spaces, and we're continuing and envisioning cleaning all spaces in the classroom as part of this. A plan like this is in a sense, dependent on all of the members of the community understanding their community obligations. And we have a video we want everybody to see before they come back on campus and to attest that they are going to comply with, in a sense, the restrictions that will make this a safe a place as possible. The pledge includes wearing masks. It includes not getting together in groups of more than 15, checking symptoms, and the like. There's also a very important part of students coming back is this commitment to the community and your fellow citizens. Obviously, in Katrina, Tulaneans came back and were deeply committed to their fellow members. We need a similar level of commitment now on the part of everybody. And I must say, the students we've talked to about this have really, I would say, stepped up to the plate. They understand how important this is to classmates, to the New Orleans community, and everyone. We're also at a moment in time where our society is transforming. The post-pandemic world will look in many ways different from the current pandemic world. And so therefore, part of this process of understanding how we come together, how we do it in a safe way is critically important. We're also in the middle now of thinking hard about how to make Tulane a more inclusive, diverse, supportive community. And everybody is weighing in on all the things we need to do, and we clearly need to move forward as a community. And coming back together as a community and being part of that conversation is critically important for all of us. So today, we will be answering questions, and of course, there are 3 more webinars after this. We have our provost, Robin Foreman, Chief Operating Officer, Patrick Norton, Lee Ham, Dean of the Medical School, Shante Bolton, Deputy Chief Operating Officer, David Mushat, who's head of infectious diseases, Scott Timms, who is head of student health, Dr. Dusty Porter, who's head of student affairs, and Kelly Venable Carroll, who oversees, in a sense, facilities aspects on campus. I wanted to briefly start, because I know it's of concern to many people, with both Dean Ham, Dean of the Medical School, which is truly responsible for our having the testing capacity, the extraordinary testing capacity that we do, and has been deeply involved with our plans, as well as Scott Timms, who's head of student health. So why don't I briefly turn it over to Dean Ham.
Well, let me, I'm just going to say a few words. The plan, as President Fitz has outlined, is an extensive one and involves many factors. But there are, people have heard about Louisiana, and I wanted to share some information about New Orleans specifically. And I'm going to show this one slide. I hope you can see that, where it shows the hospitalizations, which is a better in green, going back to March, and this is in Region 1 of Louisiana. Region 1 includes New Orleans, but it also includes the neighboring county or parish, Jefferson Parish. And as you may know, in late March, early April, we had a very similar pattern to New York, an early surge in cases, a lot of hospitalizations. Currently, the state as a whole, for the past several weeks, has had an increase in cases, which have recently begun to taper. But New Orleans itself, probably in part because of having a very proactive both governor and mayor, compared to some of the surrounding states, have had instituted a number of mitigation strategies, social distancing, mask, closing of bars. And so that you can see in the green line that even though we have had from the middle of June until July, we had some creep up in the number of hospitalizations. It's not been nearly the situation that we had at the end of March and the early part of April. And so even though Louisiana has been grouped in with other states in the South, Texas, Florida, as having significant difficulties, and we have as a state had lots of cases, but New Orleans has fared well. Again, I think in part because we've been so proactive compared to some other regions, and the governor and the mayor have recently doubled down on those efforts. So we are watching it. I would say daily, but it's probably more frequent than daily. And the trends are favorable. And so we're watching it closely. And so Louisiana data is not New Orleans data, and we intend for it to stay that way. And we intend for the students to be even a more protected group within the city. So I think that's the main message that I wanted to give you in this abundance of data about both what's going on in the city and the plans for Tulane. Thank you.
Thank you, Lee. Now I'd like to briefly turn it over to Scott Timms, who's head of our student health, and I believe president-elect of the Student Health Association, who's really been overseeing our the testing protocols and health protocols. Scott?
Great, thank you. So I'm gonna just briefly sort of give you an overview of all of the different types of testing that we're gonna be doing and ways that we're monitoring for COVID on campus. So we have really put together a very, and I would say we're very lucky to have our School of Medicine lab to provide the support to do this testing program. But we've put together a really robust program where we're going to be looking at all of our data and our testing in a variety of ways. So in addition to the surveillance testing, which number one question I'm getting right now is when will I know? So emails will begin going out in the next couple of days. There's a university-wide communication tomorrow and then later this week with specific details on scheduling for students who are arriving beginning at the end of the week. But the initial testing begins this week. We started doing some of it today and it will begin now through August 18th. So we'll be testing all 20,000 members of our community through one of our testing centers. Beginning on August 19th, we will go into a rotation of testing about 5% of our population every day. We'll do a random selection of people across campus looking for COVID hotspots or infection. In addition, beginning this week for staff and on Monday for faculty and students, a daily COVID check reminder will be going out, encouraging people to monitor symptoms and report back. That data will allow us to look for hotspots of infection where people might be reporting a variety of symptoms, and we might change our testing protocol based on that. So we're using our data in really smart ways to sort of find where COVID outbreaks might be happening so we could intervene more quickly. In addition to those sort of surveillance opportunities, we also have testing set up for anyone who might be sick. We're opening an uptown wellness clinic for faculty and staff in addition to the downtown clinic. So any faculty or staff member who is symptomatic will have access to COVID testing there, our quick test through School of Medicine, in addition to campus health having extended hours this fall to serve any students who might experience symptoms. So we, again, have expanded our access, everyone's access to care to get those tests done in a timely manner through a testing program that we know provides good results. If we have a positive result, we have contact tracers. We have 3 full-time contact tracers on staff within campus health. They have begun their work. They're not all on board with this yet, but some of them are, and we have begun contact tracing. So if we identify a positive person, we will work with them to find either quarantine or isolation space based on the situation. We have Patterson isolation and quarantine space, which President Pence mentioned. So we have a plan for that, and we'll be working with our faculty staff as well on how they would isolate or quarantine in their homes. So again, a very comprehensive and robust program that will allow us multiple ways to intervene, identify cases, and hopefully stop the spread of COVID on campus. It's a lot of information and a lot of new systems and services. And I know, especially I think this initial testing piece is causing some anxiety and some questions about how it's all going to happen. The information, again, is coming out this week. So if you're a student, please make sure you're checking your email for that so that you get the directions on sort of how to access testing. Off-campus students will have the same access to the testing programs in our isolation and quarantine spaces. So we have set that up so it'll look the same for everyone. So more information to come. Watch your email for that. Watch for your daily COVID check. And yeah, I think that's it.
Thank you, Scott. That's obviously a sort of an overview of all that we're doing for the community at this point. And now I would like to open it for questions. I can assure you we will not get to all of the questions, but we encourage you to submit those questions to the website and we will respond. So with that, I would turn to Carrie Stockwell of my office, who's going to be reading the questions.
Sure. The first question is about enforcement of gatherings. It says, I know the school's policy on students breaking the rules of gatherings, but how can you ensure they will be enforced?
Dusty, do you want to talk?
Sure. So we have been very focused on coming up with guidelines for our entire community, including our student community, that adheres to, in essence, right now the mayor's expectation that gatherings are limited to 25 or smaller for inside, 50 maximum for outside. We're going to be sharing those guidelines with all of our incoming students related to what our expectations are. And we will be really working with our community to, in essence, invite and engage all of our students to help monitor sort of what's happening and how we learn about those. Obviously, we have a lot more visibility about what's happening on our campus in terms of student organizations and clubs and events and programs, and are ready to help those student entities be able to have a successful semester in terms of still having events. We also will be asking our student community to be thoughtful and helpful with us if they know of students that are having events that do not follow those guidelines to let us know when that happens. I think our entire student community knows that we have a concerns portal that allows for anonymous sharing of any kind of concern. The COVID website, which is now up on campus, also has a COVID portal for people to share a concern if they feel like there's something that needs to be attended to. So we've been working with our students here during the summer to think about ways of really messaging out about the importance of adhering to our policy, not for oneself, but for one's own. It's a perfect example right now with COVID that we're all in this together, and our behavior and our decisions can actually affect the lives of other people, including the lives of the citizens of New Orleans. So that will be our approach, and we'll be asking everybody to engage with us as we seek to have a healthy semester over the fall.
The next question is about what happens after a test result comes back positive, either at the arrival center or the testing center. But I think it might also be helpful to know, whether it's if student, faculty, or staff, what happens if you get a positive result.
Sure. So a positive result really at either of the locations would sort of initiate. One is a phone call from one of our staff in campus health, likely a contact tracer depending on the situation, to notify the individual about their result. We would then talk through sort of their action plan and sort of best case scenarios. So if it's an employee, we would talk to them about self-isolating at home, making sure they're linked to medical care to get advice on how to manage any symptoms if they're symptomatic, or if they're asymptomatic, which is likely the case, how to self-monitor for the next 10 to 14 days based on, the scenario. The guidance on sort of medical clearance just changed, and so we're constantly monitoring that. Our biggest goal with faculty and staff is making sure they're linked with a healthcare provider to help manage that. We'll be directing them that way. Similar for students, one of our providers at the health center would manage them. We would, if they are living in a residence hall, they would be going to the Patterson space. If they lived in an off-campus facility, we would work with them to see what the best option for them is. Sometimes if they live alone, it might be best staying in their own home. If they have roommates who also might test positive, it might be best there. So it really varies. We aren't gonna, I've had a lot of questions are, if my student tests positive, are you gonna lock them in a space? No, we're not going to lock them away or hold them prisoner. We're gonna work out a plan with them. It's also true parents could come and get their student. That's been another common question. If a student tests positive, can I come get them? Of course, we would be happy to navigate so that you can get them, take them for care as you see fit. So all of these scenarios, there will be individual plans with all of the people around quarantine and isolation so that we can act appropriately. The arrival center is a little bit different because, to move on to campus, you have to get a negative test there. So if we get a positive at the arrival center, we'll immediately retest just to confirm those results, and then we'll work with those individuals about what their options would be. If the parents are able to stay and want to keep the student with them until we're able to medically clear them, they're welcome to do that. The Patterson isolation spaces would be open, and we could move the student there as well. All of the orientation programs will be available online, so they would be able to participate virtually until we could get them medically cleared.
Okay, Scott, just one follow-up question we received. Will the infirmary be staffed with nurses and doctors?
The infirmary will be staffed with a variety of people from campus health. Our nurses will be doing daily rounds, doing several checks a day. We're not providing nursing care there. It is checks. So anyone at the infirmary would need to be able to take care of themselves. If they required a higher level of care, we've been working with the med school colleagues in Tulane Hospital so that students would have access to hospital care if that was necessary. But we will have nurses and physicians that are there checking. If they needed a visit, we could do a telehealth visit. They could also come over to the health center, but we would be coordinating any type of care that they need there. We will also have it staffed overnight with EMTs. So there will always be someone there in case there's any sort of an emergency that could activate emergency services if necessary.
Hey, Carrie, before you go on, I was just asked to remind everybody that actually, in addition to the parameters that I stated about 25 and 50, that is 15 for off-campus residences. So I just want to make sure I got that out there. Thank you.
The Tulane requirement is 15, and we will be enforcing that.
Okay, next question is about employees. If a faculty or staff member has arranged to work from home, will they still be potentially selected for random testing?
So in the email that will come out, if you are a remote only worker or student, they can email and we would take them out of the rotation for the testing. We do not want to test you if you're only a remote student or working. So we have had some departments provide us names, but you'll have an opportunity to opt out of that.
Okay, great. We received a couple questions about students arriving early for wave leaders or new student orientation. Do those students who come back early need to be tested in advance of their return, or is it being done on arrival? And where will this be, at the arrival center or the medical center?
So those students all are arriving this week. They will be getting their emails tomorrow, I believe, with the opportunity to schedule for testing upon arrival. So they should just watch for those emails because they will come out. They'll be tested upon arrival. It's a slightly different process than students who are going to the arrival center because these students are getting here the day that they move in, not early. But we have a protocol for them and they'll have access to the testing center, which will be open when they arrive.
Great. What happens if a student doesn't show up for their testing during the semester?
So I've been working with Dean Woodley on that scenario. And so the testing protocol, when they receive their emails, everyone will be given a window of time to schedule their appointment and go. If a student fails to report for that, we will be reporting that to student conduct. And there will be an interim suspension put on until they complete the testing protocol.
Okay. And will testing be free?
Yes, there is no charge for any of the surveillance testing provided. It's all funded through Tulane.
Great. Couple questions about campus life. When the students are in the dining halls, are they able to eat at the same table as their friends?
I'll jump in. I think the answer is yes, but socially distanced.
Yeah, just to repeat what I said before, the Commons holds 1,100 spaces, which is close to 3 times what Bruff did, and we're adding a huge number of additional spaces with a temporary dining facility. So there is the opportunity for everybody to eat at a table with other people, but properly socially distanced. Obviously, food has to be served. We can't have people, as they did it at the Commons, taking their own food out, and that really is to protect the health and safety of everyone.
Hey, Mike, just to add on the temporary structure, so we're not only having the Commons, but the dining pavilion is going to hold up to 300 individuals. Actually, 299 to be exact, with being socially distanced. So that's a fair amount of seats. That plus the Commons, which will hold close to 400 or over 400. So that's a fair amount of diners at one time, socially distanced. Full stop.
Just to underscore the implications of what Patrick just said, the Commons holds 1,100 people for food ordinarily, but in this world, it will only be 400 people who will actually be able to eat there because of the distancing requirements.
Next question is about student interaction and how to support it. Who can students interact with? Will there be cohorts that they can interact with? It's a lot to be away from home for the first time. Their mental health is important, but obviously a difficult balance challenge. Will teachers have office hours?
A great question. And obviously important, because that's the reason you're coming back on ground. It's the engagement with fellow students and it's the engagement with faculty. I don't know, you want to, Robin, do you want to talk about faculty?
Yeah, so they will have engagement with faculty. Faculty will have office hours. In many cases, though, those office hours will either be virtual or outside. We're setting up lots of spaces where faculty and students should meet outside in small groups, wearing masks and socially distanced. Excuse me. And we actually have a committee chaired by Laura Osteen and Kelly Grant, the Student Engagement Committee, that is designing a whole host of mechanisms by which students can get together with each other, with staff and with faculty safely, largely outside, but in fact in all kinds of ways, to make sure that the semester is as engaging as a typical semester. Our students will be spending less time in the classroom than they would ordinarily, and so we recognize the need to make up for that because we want the semester to be as engaging for all the reasons that are implied in the question. So yeah, they're going to be continuing engaging with each other and with everyone else in the community, but in ways that are as safe as we can manage them to be.
And I would just add to Robin's comments and say, as he noted, that Student Affairs and Campus Life have been thinking all summer about how do we continue to foster the amazing aspect of Tulane, which is community and engagement. We've had a group working on how we can support our student organizations to understand ways that they can continue to program and have events. The Riley Center will be open, and we'll have students in there that will be working out, but again, in ways that are conducive to staying healthy. And so we've been very proactive in thinking about what does this look like. And a good example is even with our arrival and orientation, even though it's staggered over move-in, students will still have an orientation group. It'll just be a smaller group than it used to be. It'll be less than 15 students, but they'll have an orientation leader. They'll be in that group over the course of the first several days on campus, and we'll be mirroring that over the fall semester in many different ways. How do we continue to engage, but it may be in much smaller ways than huge ways in terms of our health.
We have a question about department and staff events. Are those events, for example, admissions tours, also subject to the size guidelines and restrictions that students are held to per the university and city guidelines?
I'll just say the general answer is yes. However, there is an exception in those limits for classes. And so things that have the structure of a class may exceed those numbers, as our actual classes may as well. But campus events that are not classes have to satisfy the rules for gatherings.
Just to explain, so I sit on the mayor's reopening committee. The fear is on normal events, when you have large crowds get together, they don't, in a sense, they don't distance from one another. They connect in ways that might not be healthy. And when you have a class, when we're talking about our classrooms, where it's really a structured situation where we have seats and people sit at a certain distance from one another. And when you have an organized academic event, you can do that. The concern of the city is in sort of events that aren't structured in that way. That's why we have the 15-person limitation for events like that, even though classes where people are at assigned seats and at a distance from one another can have larger groups.
Kerry, if I might, on the departmental gatherings or meetings, we're going to encourage where we can is to continue to have virtual meetings, staff to have virtual meetings. But there are times when you need to come together as a group, and some of us on this call actually did come together maybe a week or so ago. There are 9 of us in a socially distanced way that came together for a meeting on a Saturday, and we were able to, we wore our face coverings for an 8-hour meeting. It can be done, right? So you can actually have a socially distanced meeting wearing face coverings that are quite effective. And we did that, but we're gonna, where we need to have those meetings as staff on our campus, we will have them, but we're also going to encourage more or less virtual meetings whenever possible. Full stop.
We have a question from a student about masks. I was wondering, if I'm eating lunch or sitting with a friend outside and we're 6 feet apart, do I need to wear a mask? And who will be enforcing the regulations about masks in large spaces like the Commons, the library, and the LBC?
Well, we don't require you to wear a mask while you're eating. So that's one. So eating or drinking, of course, you can't wear a mask, so that's fine. In general, if you're with other people, not eating and in common areas together, that's when we are asking that you wear a mask. I'm going to let the enforcement piece, I think, is student conduct has been working on that. I don't know if Dr. Porter might like to comment on the enforcement.
Well, again, I think it's going to be a combination of working with TUPD, student affairs, other folks on campus. Our goal is not to, in essence, come down hard and fast if someone's still learning the rules, right? If there's something egregious and you're hosting the kind of event or being really kind of purposely, I don't care, I'm still going to have this type of activity, it'll look one way. I think we're going to try to really work with our community at the beginning, because for all of us, it's new behavior to try to remember to put on your mask. For me, walking from my car to my office, walking across campus for a meeting. But I think we are going to be, again, asking our community to engage with each other, but certainly the staff on the campus that typically would broach individuals that are not following through would be a combination of folks like TPD and student affairs. And again, anyone can share a concern if they feel like they know someone that is just not willing to take the steps necessary to keep each other safe.
It does. Oh, go ahead, Mike.
There are obviously a lot of different ways to protect the health of the community, but my impression is mask wearing is really viewed as one of the most effective. I should turn it over to David Mushat, who I know, head of infectious diseases. I shouldn't speak for him, but I do think that is, a very important way to protect our community.
I couldn't agree more, President Fitz. There's a really interesting scenario that played out in the last few months that was reported by the CDC and the MMWR a week or two ago. And it consisted of, it was a cohort of 50 or 60, I think, women who all went to the same 2 hairdressers. And both hairdressers it turned out had active COVID infection. But they wore regular masks, and all the women wore masks. And guess what? Not a single one of the customers got infected with COVID. And in my mind, there's no better proof in the pudding than just the simple act of wearing a mask. And both parties doing that has an enormous protective benefit for everybody. And so I think that should be very reassuring. We just need to, we need personal responsibility here. We need to want to do the right thing. I think Tulane strikes me as the kind of place, we're number one in student volunteerism and giving back to the community in the United States. So I see this as kind of a natural outgrowth of that we're going to do the right thing with our fellow citizens, students, faculty. We're gonna be good to each other, and that's going to hopefully will set a great example for the rest of New Orleans and the rest of Louisiana.
Hey, Dr. Mushat, we talk about kind of those 4 golden rules, right? The 4 golden rules to controlling the virus, right? The transmission of the virus, and really haven't changed for months, right? And that is, masking, right? Face
Correct.
coverings. Number 2 is socially distanced or physically distancing, right? And the third
Correct.
one being kind of checking your symptoms every day. And if you're, showing symptoms, for goodness sakes, don't go to class, go to work, contact your healthcare provider. And number 4 is just the basics around personal hygiene, right? Wash your hands, clean your workspace, et cetera, right? That really hadn't changed in months, right?
No, it really hasn't. I think it's just, it's taken time to get the evidence or the data behind that. I think we all kind of knew it, but it's nice to see that the evidence now really does support that. I think it's, it's nice that they're fairly simple measures. It's a nuisance sometimes, but I can tell you it's simple. It's a small sacrifice that we all have to make. But if we do it and we get it right, we'll get through this faster. We'll get back to normalcy sooner. Our sports teams will get back. Our schools will get back. It is a very small price to pay. And think of not just yourself, but we need to think of everybody else, our fellow citizens. Do the right thing because you're helping them. And then, through the 6 degrees of separation, you're also helping yourself and your family. We're all in this together.
And what's interesting, you can trace everything we're doing as a community. I mean, everything we're talking about today and everything we're actually implementing as a plan back to those four rules. It's
Absolutely.
I mean, that's it.
Patrick.
Yeah, I'd just like to add, there have now been 2 questions about enforcement of the rules, and enforcement is important, but it doesn't start with enforcement. As David and Patrick were saying, it starts with educating the students about what we expect, and it starts with changing the culture. We've got student leaders who have a whole host of ways to make sure that wearing a mask, for example, becomes the norm, right? Mm-hmm. It becomes, you get to the point where you feel weird if you're not wearing a mask, like you just don't fit in. Right? It's about changing the culture, and it starts in the Welcome Center, where we're going to have a whole host of programming to get people, introduce folks to what the norms are, what the expectations are on campus, and it will continue through the school year. And of course, we will enforce it when people willfully disregard the rules. But that shouldn't be your plan A for how you get people to behave in the right ways.
Hey, Rob, I think you're absolutely right. It's the willful kind of non-compliance where the enforcement is going to go down heavy. We understand people are going to forget. I mean, we all did, right? When we first were masking up, oh, geez, I forgot my mask in my car. I forgot my mask at home. I have to run back and get it, right? That we understand that. That's part of the education process. But it's the willful non-compliance where enforcement is going to be really needed. Full stop.
Gary, next question.
I have a question about the temporary classrooms. Will they have desks and air conditioning?
Yes.
Yes, both. They're extraordinary. They really are.
Another question about campus access. Will campus remain open to the neighborhood? Many non-Tulanians jog or bike on campus regularly. Will that be curtailed?
Yes, we really are closing off the campus to outsiders and visitors. I regret that. Certainly there are many people who take advantage of the Tulane campus. It's beautiful, it's gorgeous, it's lovely, it's wonderful. But as part of this process, as I said, we're testing everybody before they come on the campus. We're creating a sort of I don't want to call it a bubble, it's not a bubble, but sort of an environment where everybody is exercising responsibility and taking care of one another and tested. And it would be inconsistent with that to allow sort of everybody to come through the campus.
So quickly, Mike, on that, we were discussing that just recently, and obviously people are going to still be able to move through our campus very quickly, you know, but as far as using the LBC, using the Commons, using the library, no, that's or the rec center, that's just actually off limits to folks that aren't part of our Tulane community.
We have a few questions about support for students if they are in isolation. If a student is at the arrival center, tests positive, they move into the isolation dorm, but then after the isolation period, how would they get their books while they're in isolation? How do they get food, medication? And then also for off-campus students who have to isolate, if they can't prepare their own food, are they just at the mercy of Uber Eats? Or is there any kind of support in place for students in isolation?
There's a variety of ways. So for on campus, we have worked with dining, and we'll have meals that are delivered to the infirmary, and we'll be working around, you know, specific food allergies and pieces. But we have a plan with dining who has assured us that they will bring meals to the infirmary several times a day so that students will have access to food. We will also have a snack room, so that we have a variety of other fresh foods and snacks and drinks and things to help the students who are there. We would, if a student who was off campus in this situation had some difficulties, we have a case management program. We would work with our case managers and with Campus Health to do what we could to accommodate those students' needs. We're not going to leave anyone where they wouldn't have access to food or to get those sort of resources. So there's a variety of supports here that would come together and help and take care of them. So our nurses have had a really good time picking out snacks for students. So we'll make sure that they get something.
Okay, great. Scott, there is also a question about thermometers. Students are receiving masks, but will they get a thermometer for daily temperature tracking, or should parents send their kids back to school with one?
So we have 15,000 thermometers, and I'm working on the distribution plan for those, but we do have thermometers for every student, and so they'll have access to it. I would recommend, because my experience has been that even though I give students thermometers every year, they never have one. So it would be great for the parent to send an extra thermometer just in case they lose one or break one or someone needs one. Sometimes they think they're disposable. So I think it would be very helpful. Just as also a reminder, please make sure your student comes with a health insurance card. We find that, and a picture of it on the phone is just as good as a hard copy, but it would really be helpful for us to make sure that we have that information should they become ill and need hospitalization or advanced care. A lot of times students don't realize the importance of those cards. So 2 important health pieces.
Okay, question about sports. What is happening with varsity sports, club sports or other clubs? Are they happening this fall?
So I can't speak to our Division I athletic teams, but I can tell you that there will be some club sports that will continue. It all depends on the type of sport it is, in terms of being able to socially distance yourself and your body contact with others. So the Riley Rec Center will be working with our club sports programs to determine what club sports can continue and what club sports will not be able to. And so anybody can contact Riley to get that information. And I will let President Fitz remark anything he wants to about our Division I sports program.
So that's a question I think every university is asking across the country at the moment. Will there be varsity sports? We're part of the American Athletic Conference. And indeed, the Health Committee of the American Athletic Conference is chaired by a member of our faculty, our sports medicine doctor, Greg Stewart, and they have put in place a whole variety of different protocols for the teams. But obviously, I think this intercollegiate varsity sports are a work in progress at this point. There's a lot of discussion at the NCAA, in the conferences across the country, about whether it will be possible or appropriate to have intercollegiate sports in the fall. So the bottom line is, we don't know at this moment.
We have a question about protests and riots. With current protests and riots across the country, are you concerned about those occurring in New Orleans, and has Tulane made or prepared any precautions or plans?
Well, let me say, protests are part of student life across the United States at universities. We encourage vigorous dissent, discussion. That's what a university is about. Obviously, in all cases, they have to be safe protests and be in a sort of a time, place, and manner. But we view that as part of what universities are about nowadays.
What question about if there's a positive test? What will happen if someone tests positive in a class? Does everyone who is in the class quarantine for 2 weeks? Only the people seated nearby, or is there a protocol for that?
So the protocol that we work from are CDC guidelines for contact tracing. And so close contact is defined as closer than 6 feet for 15 minutes or more. So when we reach out to the student, we will work to identify those individuals who would have been, who meet those criteria. Most of our classrooms are spaced out in ways that not necessarily anyone in that classroom might be a contact. So it really depends on the situation, who had close contact as defined, because those are the individuals who would be at most at risk for infection. Those guidelines are constantly updated. They were updated this last week. So we're always updating and sort of following best practices in regards to who we would notify and take action.
Let me underscore, that's exactly why we've added 18 new classrooms. That's why we've distanced in the classrooms we have, so that literally if you're in a class, you are in a sense distanced from the other individuals in that class. And obviously you're wearing a mask as well.
Question about hurricane plans. What are the plans in case of a hurricane and needed departure for students who may be in quarantine?
If we have,
Yeah, oh, go ahead, Scott.
if we have students who are in isolation or quarantine related to COVID and we choose to evacuate, we would have a separate, but, and they're, again, not able to go home or have some other plan, we would have, we've worked out, we have a busing system. They would be on a separate transport to our off-site location in Birmingham. So we've talked that through. We have a tabletop to practice that out in a week or so, I believe, but that is our plan.
Yeah, so we plan for hurricanes every year. This is now an overlay, the COVID overlay into our hurricane planning. And Scott is absolutely right. If we have students that are in quarantine, we're going to have to move them separately on the buses. And that's if we evacuate, right? So there are two possible situations. One is we evacuate, and that is going to require a pretty major storm for us to evacuate, or the shelter-in-place model, which is for lesser storms, and that is simply our normal shelter-in-place plans now with kind of the COVID overlay around social distancing and masking, et cetera.
If we did the shelter in place and stayed on campus, we would have staff that would stay in the residence hall to make sure that any health needs were met. So we would have one of our physicians and some of our nursing staff.
And just so you all know, we put in our redundant, we really invested heavily into redundant systems. So we have tremendous amount of backup power, et cetera, to ensure that in a shelter in place scenario, our students will be kept safe. Full stop.
Our approach to hurricanes has changed over time, as Patrick said. We have much more power and resistance, so that it's certainly much more likely we would shelter in place. But obviously, in a certain circumstance, you can envision our evacuating, and we go through constant plans, tabletops about how you would evacuate in a circumstance like this.
Okay, I think we have time for one more question. It's about classrooms. Will seats in classrooms be marked off for social distancing so professors don't have to be the seat monitors and give reminders every class?
Yes, absolutely.
They're actually
Kelly, we should give you an opportunity to talk about the work that you've done to really ensure the sort of the cleanliness and safety of the classrooms.
Yeah, well, President Fitz, not just the classrooms, but the entire campus. So my team and I have gone through and assessed all spaces on all of our campuses. All spaces have been sanitized and disinfected, and we're currently going through classrooms and socially distancing and laying out all the seats at a minimum of 6 feet. And that includes 6 feet away from the lectern as well. And all lecterns will have a plexi panel in front of them to protect the faculty member from the students. In addition to that, like you mentioned, we have the 14 tents that we've installed on campus, and then we've taken a lot of spaces that typically would be used for like auditoriums. So Devlin, McAllister Auditorium, Dixon, that we're turning these auditoriums into non-traditional classroom spaces as well to allow for socially distancing.
And don't forget and Robin, and don't forget the technology. And Robin, you may want to talk about that. I mean, we're upgrading hundreds of classrooms with technology to allow for excellent instruction in a socially distanced way. So, Robin.
Let me say, in terms of classrooms, there are two kinds, those with movable furniture and those where the seats are planted into the ground. The ones with movable furniture, we've taken out furniture and spaced out what's left so that the chairs in there are socially distanced. For the classrooms where the chairs don't move and they're fixed in place, we have put stickers. We're not done with all the classrooms, but there will be stickers on the classrooms saying sit here and don't sit there. So precisely so the faculty don't have to be seat monitors. All the large general pool classrooms and many other classrooms, as Patrick was saying, have been fitted with state-of-the-art technology that allows for high-quality lecture capture, not just Zoom, but high-quality lecture capture, so that if students have to leave the classroom and go into the infirmary or stay out for any other reason, they can continue their academic progress.
I want to thank you all. Let me underscore what should have been obvious is everybody who's been part of Tulane University has been deeply involved in thinking through how best to come back on ground and how best to have a great fall semester at Tulane. And there are lots of details in all of this, and I encourage everybody to look at the website and go down and look through the details. We'll be answering questions as we go forward. We have 3 more webinars, one for students, one for faculty, and one for staff, where we'll be answering questions really focused on those different groups. Today was really to step back and look at the overview, the precautions we've taken, have those individuals who are deeply involved in the medical issues to be able to talk about all that we've done. In the end, this is about protecting the welfare, the health, and safety of the community. And as you can see, we have a number of initiatives. We're constantly thinking about things that we can do that would improve the safety of the community. Again, there's nowhere in the United States at this point where folks are not at risk. Our goal is to protect the community, protect the campus of the community, and to ensure that we have the vigorous academic program in a safe environment this fall. So thank you all for being part of this. I encourage you to attend one of the other webinars, and also you can submit questions to our website. Thank you all for being with us today.